Both these doctors, Dr. Lisa Richardson, Dr. Jason Pennington, walked into an academic institution as people. They happen to be of Indigenous descent. They are two fantastic people, and they're leading the cutting edge of Indigenous inclusion in the medical sciences. They became mentors for every person out there, not just racialized people, but anybody just walking into an institution and needing to make changes.
One of the things that needs to happen to improve the health for Indigenous peoples in Canada is to recruit more Indigenous healthcare providers.
During my 4 years of medical school, there was actually 1 year when I was the only identified Indigenous student in the whole 4 years of the medical school.
So we have created just in 2012 a special pathway where Indigenous students have a parallel application program. They meet all of the same academic cutoffs. So these are outstanding students. But there is an additional layer where we have a committee or a circle of community members, academics, and other Indigenous students who review the applications.
So from a student admissions perspective, we have definitely had an increase in the number of Indigenous applications. When I went to U of T medical school from 1996 to 2000, there was one lecture on Indigenous health in the whole 4 years of the curriculum. And it was taken from a public health, a very westernized version of public health, and was quite paternalistic.
So the office was started to create a safe space for the medical students that we were recruiting, Indigenous medical students. We wanted to create a space of support where there would be access to traditional teachings if people wanted that, and then also a place where we could work to create curriculum in Indigenous health.
Students go to Indigenous organizations and write self-reflective pieces after having spent several weeks visiting different Indigenous organizations around the city related to healthcare and with just well-being in general.
Students will go into community and participate in drumming circles, meet with elders, go to community socials, go to powwows. So they really do have quite a different experience than a clinical one, but they come away with a very deep understanding of colonization, the impacts of colonization, and what their role is as a provider for Indigenous patients.
It's been very fruitful, and I think that's the real thing, is to get away from didactic lectures, because it's easy for students to start saying, yeah, I've heard about residential schools, yeah, I know about the 60s scoop, but when you actually go out and meet people who lived it and people whose families went through those events, that's when we really get people to truly understand.
I bumped into a resident the other day who said, that was the best panel, that was the best experience of all of my medical school.
The pair of them are an amazing set of mentors, whether or not they'll admit it. And if you talk to the pair of them, they will kind of be shy and say, oh no, not me, but they are mentors. And they are worthy of being marked somewhere in history, worthy of being recognized. I think we're still running the old systems. There is no way they could escape being elders, wisdom keepers, traditional teachers, knowledge keepers, because that's what they are. They happen to wear a different clothing now. They happen to walk in a bit of a different world, but that glow that surrounds them is still there.